So hi everyone and welcome to the CSAE Development Economics webinar. Just before I introduce our speaker, I want to just go over a couple of the ground rules. So our speaker will present for 45 minutes, and during this time, if you have any clarifying questions, then please use the Q&A function to type in your question, and then we may interrupt the speaker and I'll read out your question to them if we think it is indeed a clarifying question. Then at the end, we'll have 13 minutes where we can have more of a discussion and broader questions together. And during this Q&A session at the end, if you have a question, then please use the raise your hand function and we'll unmute you so you can ask your question live. And I'll also just remind any panelists, if you have questions throughout the talk, then please use the raise your hand function and we'll unmute you to ask it. So I'm very excited today to welcome Nancy Qian from Northwestern University, who's going to be presenting NGOs in Uganda. So thank you very much for joining us today, Nancy, and over to you.
Hi, everyone. Thanks so much. I'll just say hello quickly. Thanks so much for having me. I'm having some connectivity issues, so I'll be presenting on my iPad. So when I share screens, I won't be able to see you and you won't be able to see me. So this is my hi. All right. Let me mute my video so that we can go quickly. Okay, so I think a few of you might have seen an earlier version of this paper a while back, so hopefully it's a lot better. This is a co-author project with Erica De Serrano and Aisha Nansamba. And what we're really interested in is we want to understand whether NGOs crowd out government-provided services. And we're going to be looking at this, as Emma said, in rural Uganda. Now, let me quickly motivate. So, foreign aid aims to create sustainable development. In the last 20 years, NGOs have really increased in importance and how much aid it administered. So both in terms of number of NGOs and the amount of aid it administers for major donors like USAID and the European Union, it's quadrupled in the past 20 years. Okay. Now, I'm sure you're all aware that there is a big debate about the efficacy of foreign aid in general. Here, I just want to focus on NGOs, right? Since we're constrained in time. Now, a lot of people the reason people really like NGOs is they're seen as being a lot more independent than bilateral aid. So they're giving aid where aid is needed, like to countries that are poor and populations that are poor, rather than according to the strategic objectives of donors. Now, that said, on the other hand, there's been a lot of debate about problems with NGOs. One is that NGOs operate independently by and large, and they don't coordinate with the government. Now, there are exceptions to this, but in the context that we're looking at sub-Saharan Africa, they typically don't coordinate with the government or each other, right? So this leads to a lot of issues. One is the replication of services. So the governments are already doing something or started to do something, and the NGO can replicate that service, which is wasteful. Another concern that comes up a lot in the discussion of NGOs in sub-Saharan Africa is that they typically offer much higher wages than the government sector, the public sector, or the local private sector. And this causes them intentionally or unintentionally to poach workers in a context where skilled labor is very, very limited. And the concern is that, when NGOs come in, they're going to be crowding out the infant public sector, right? So they're actually hindering the development of government capacity in its infancy. And people like Dambisa Moyo worries that this can, instead of reducing aid dependence and creating sustainable development, it can actually increase long-run dependence. Okay, but that said, even if all of this is true, the silver lining in this is that a lot of people think that NGOs provide higher quality care than the government. So when we think about policy, first we need to figure out whether there is crowding out. And then we sort of need to understand whether the potential downside of crowding out for the long run is just offset by NGOs providing better care today to the poor population. Now, okay, so where are we at now in terms of the literature? There's very little empirical evidence on how NGO affects government capacity. Most of the arguments about crowding out are impressionistic or anecdotal. And similarly, when we look at impact evaluations of NGO entry on population well-being, the results are typically quite mixed. And I'll talk about a little, our paper will speak to all of these issues. So what are we going to do? So in this paper, we're going to ask whether NGO administered aid help or hinder the public capacity of the recipient government. The main challenges are data and causal identification, right? So whenever we're thinking about aid, we worry about reverse causality and joint determination. So the fact that a place has low government capacity can increase the flow of aid. The original mission, the main mission of NGOs in the context we're looking at is to be a stopgap in places where the government doesn't provide any services and the people are very poor and there's a lot of demand for such services. So reverse causality is sort of, you expect reverse causality. You expect the NGOs to target places with low government capacity. The second issue is joint determination, right? So low government capacity and the arrival of aid can both be outcomes of other issues, like a very low baseline level of population well-being, or a high baseline level of infant mortality. So what we're going to do to address these issues is we're going to estimate the causal impact of foreign aid on recipient government provided services using random variation in aid rollout. So we're going to be studying an RCT that was conducted by this NGO as part of an internal evaluation, which they ended up not doing the evaluation, but they gave us all the data afterwards. Now, the outcomes we're looking at are going to be government workers and services. That's our measure of government capacity. How many workers are there to provide government services and the actual services that are being provided. And then to get a sense of whether the crowd out we look at are important or not, we're also going to look at downstream outcomes, right? These are the outcomes that these services are supposed to improve. Specifically, this will be health behavior in the household and infant mortality. Our context is one that many of you are very familiar with. We're going to be studying rural Uganda. The aid that we're looking at is delivered by one of the largest NGOs in the world. The government services are very new in this context. The government rolled out its services 1 year before the NGO entered. And when the NGO entered, entry was randomized. So half of the villages that entered had a government worker and the other didn't. The NGO and the government provide exactly the same free of charge health services, and they have the same mission in terms of what they're trying to do, improve the health of households with expecting mothers or households with very young children and reduce infant mortality. So a key aspect of this context is that the NGO offers much higher compensation than the government. Both NGO and government workers are part-time. Government workers are volunteers, they're unpaid. NGO workers are paid a piece rate for selling health commodities during the household visits where they provide healthcare. So I'm going to talk about all of this as we go in, but these are just some basic facts to keep in mind when you interpret our results. And the other thing to keep in mind is that, all of the features of our context are pretty emblematic of the context that people are talking about when they're talking about aid crowd out by NGOs, places where the government has very low capacity overall, but is trying to build up, places where the population is very, very poor, where the government often relies on volunteer or very low paid workers, and where the NGO uses this dual task model to pay their workers. Let me just say very quickly that the effects of government capacity is actually, the effects of NGO entry on government capacity is actually ambiguous ex ante. On the one hand, higher wages offered by the NGO can attract government workers, leading to poaching and a reduction of government capacity. On the other hand, in this context where people are very poor and know very little about the benefits of basic health services, the entry of the NGO can actually educate villagers about the value of these services, and this can increase the number of people who are willing to work for the NGO and the government, right? So we're going to be estimating the net of these opposing forces, but in principle, it can actually go either way. Now, let me review, I'm going to preview the results quickly and very quickly go through the literature and stop for questions. So our results are pretty straightforward. So what we find is that in those villages where there is a government worker at baseline, when the NGO enters, it reduces government capacity. Specifically, what happens is that in half of those villages, the NGO just hires the government worker, right? So this is going to reduce the amount of government provided services, reduce the number of government workers, and actually we find that it reduces the probability that households obtain services from either the government or the NGO provider. And finally, infant mortality increases. So in the other half of the villages, the NGO hires a second worker who is not the government health worker. And in these villages, the total amount of services increases. Oh, sorry, I should say this is a typo. The total amount, the probability of seeing either healthcare worker is unchanged, but infant mortality goes down, which suggests that the quality of services is increasing. Okay, and then in villages where there's no government worker at baseline, and this effectively means that there is no health worker of any type at baseline in our context, when the NGO enters, total services obviously increase, mortality declines, but we see an increase in the number of school closings. And what we think is happening is that the reason that the government wasn't able to have a worker, so the government had a universal workout. The villages that didn't have a government worker were the ones where the government wasn't able to find someone who was willing and able to do the job for free as a volunteer. And when the NGO enters these villages, the NGO essentially hires a teacher to be their part-time worker, which increases the number of school closings. So these results support the concerns that there's crowding out in villages, that the NGO can crowd out government services in places where skilled labor is very scarce, right? The silver lining of all of this is that in places where the NGO is able to hire a second worker, which is presumably where labor is less scarce, they do a really great job of reducing infant mortality. Okay, just very quickly, oh, sorry, go ahead, Emma.
There's just a question from Chris Woodruff.
Hey, Nancy. So I guess I'm surprised you're focused on quantity of workers rather than quality workers. I would have thought that the crowding out would come at the quality, and that I should think about all these places as having somebody out there who could do this work. And the question is how good they are.
Right. That's a great question. So we would love to measure both quantity and quality directly. We can only measure quantity directly because we don't have time allocation data. The way we get at quality is to look at the downstream outcomes. So what the data we can measure are are the outcomes I'm showing you. So we have the number of workers from the NGO and the government. Our household survey tells us whether the household obtained any health services from one or either of these healthcare providers, right? So that's a crude measure of quantity of services conditional on the number of worker. But then we don't have any measure of quality, like how many hours they spend, what do they say? I shouldn't say any, we don't have good measures. There's just a lot of missing values. And we don't, for the NGO workers and for the government workers, we just don't have anything. So that's why those downstream outcomes are important to us, right? Because they allow us to infer something about the quality. Does that answer the question?
Yeah. So I guess you're going to get to this, but then let me let you go on. I'll come back to it if it doesn't clear up.
Okay, sure. Anytime, just jump in, and I'm happy to talk about it more afterwards too.
There's also a second question.
Yeah,
Nancy,
please.
if that's okay.
Hi, Nancy. So I do have a question about this employment, the contract itself. For instance, so these workers who is actually shifting from government sector work to the NGO work, do they know that their employability? I mean, is it kind of long-term work or like a permanent work? And then do they know that this is just fixed contract and then they actually have to find out job again?
Yeah, so there's really no contract in this environment. No, not formally anyways, right? So the question is really about what the worker's perception is. So our understanding is that they don't have a perception of building up a career with either the government or the NGO, in the sense that these are both really new programs. They're not known to kind of promote women out of the village into higher level jobs. The women here are part-time workers, and the NGO and government recruiters in the urban areas that are kind of managing these guys are, you know, they're much more educated. They already live in the urban areas. So it's not, there's no sense that these part-time rural workers from the villages see that as like see a career track in either of these things. I think there are senses that they're in it to help people, they're in it for the money, and they're in it to learn some stuff, right? And that's about, without much more concrete thinking about the future.
Yeah, thank you.
Sure. These are all, oh, sorry, go ahead.
And one more question now from Ung.
Thank you. Hi, Nancy. A follow-up question to Professor Woodruff. I wonder whether in your data you can get at the quality, the question in particular, looking at who is joining who is transitioning out of the public sector to the NGO sector, in terms of the educational makeup, the number of years work experience, and who is left behind. Another thing is,
yeah, sure.
Yeah. Anyway.
Oh, sorry, go ahead. No, go ahead. There's a delay.
No, another thing is I wonder with some sort of like time lag effect, in terms of, especially if some of the surplus labor are moving out of the public sector into the NGO sector, whether how public sector adjusts to that, like being able to hire fewer but like more qualified workers, for instance.
Yeah, so both of these are excellent questions. So let me answer them both, just in case we don't get to it in our short presentation. The first thing is, we can't look at who is switching directly because our data set doesn't have data on the government workers. We only see government workers if they switch to the NGO. But we're actually going to use another data set from the same NGO operating in a different part of Uganda. That's part of a different study that Erica did, where we actually where we actually have data on everyone who applies. And we're going to show some evidence of negative selection in the sense that the people who move, the government workers who apply to the NGO are the ones who self-report as caring more about money. We don't see any differences in education or other things like that. If anything, because the NGO, basically what we see is the NGO always hires the most qualified worker that applies. And in terms of what they do, because they're doing the same thing, the most qualified and for caring about money. The second thing about, so one of the key policy takeaways, one of the key policy takeaways of this paper is that the government and the NGO should coordinate a bit more about, they should share information about where they're working, and to do that, the first step is they need to collect data. Right now, the Ugandan government, actually no government with very few exceptions, those operate in the Ugandan government doesn't have data on where it's set. So there's no centralized data, right? They can't make a centralized response by reallocating. Look and see if, is there a localized response? That's why we looked at schools. We thought maybe when the NGO comes, that can free up resources of skill, that can free up some resources at the local level in terms of monitoring or whatever, and we'll see an improvement in schools. But we actually saw the opposite, which is that schools close more. And we think it's because the NGO is hiring the teachers. Okay, so I'll push forward a little bit. Thanks for all the great questions. I'll be very quick on the literature because there's a massive amount of literature in the aid space, which I'm not going to talk about on this one slide. But I'll say that recently there's been some attention on crowding out, which is really important. One is a paper by Cruzati et al. And they're looking at Chinese project aid, and they show that when Chinese project aid comes to Africa, the African countries reallocate resources away to other regions. And then another paper is by Baldwin et al. And they show that when an NGO arrives in Ghana, local public investment goes down and in response to the NGO arriving. So both of these studies is talking about the point that was just made by whomever asked that question about reallocation, which is that the government is responding and reallocating their resources depending on where the aid is going. So ours sort of add to that because we're looking at a context where that reallocation is impossible because of the lack of information. We're also, there's also within the aid literature, a bunch of studies have looked at how aid reduces institutional quality. And these are stories of moral hazard at the level of the central government, like they don't invest on improving. So the central government doesn't really play a role here. So, we kind of contribute to that by looking at another unintended consequence just at the very, very local level. And finally, I want to mention that a bunch of papers have simply evaluated the impact of NGOs, including the ones that we study, using the dual task model and other payment structures on outcomes like education, mortality, health in sub-Saharan Africa countries. And these estimates are pretty mixed. And one of the reasons, if you believe our results, then one of the reasons that they might be mixed is that they're not taking into account underlying heterogeneity in things like the presence of government services and things like government services, right? And I want to mention that our study, in terms of the context, our study is very closely, most similar to Björkman et al. The paper by Björkman, Guariso, Svensson, and Yanagisawa-Drott, where they look at two NGOs, one of which is the one that we study, and they see that when the NGO enters, it improves the infant mortality on average, but it actually reduces the probability of health advice from government workers, which is similar to what we find. So in that study, they don't have data on which village has a government worker or not. So they don't really get into heterogeneity or crowd out. Okay, so this is a roadmap. I'll talk about the background briefly. I'll talk about the empirical strategy in the context of presenting our main results on government capacity, which is workers and services. And then I'll look at poaching specifically and downstream outcomes. All right. So very quickly on the background, I'm going to go fast because I think this audience is very knowledgeable about the background. And I'll just try to focus on things that's not very, that's not common knowledge. So in our villages, the only source of modern healthcare are the government workers and the NGO workers that we're studying. And the way that these guys provide care is that they make home visits. Other sources are traditional healers and drugstores, which dispense advice when they sell you aspirin and other things like that. In the urban area, healthcare is much better. There's private clinics, government hospitals, and health centers, but these communities we study are quite poor, so there's quite a bit of search and travel costs to urban areas. So let me talk about the government health program. So the government health program aims to provide basic health services during home visits. They give health education about the benefits of hospital delivery. They tell the mother, it's always the woman, they always target the woman of the household about disease prevention. They provide postnatal checkups and basic medical advice. They also refer these women to health clinics and this is a very important part of their service. You know, they tell them things like, oh, you know, the baby is breached, you need to go early, your blood pressure is high, you need to go and get checked out. Afterwards, they come and make a physical visit and they say, well, do you have a fever? Do you have a blood infection? These things are, if you do, you know, you need to go to the urban clinic, get antibiotics. So these are very, very simple things. But these are things that that can make the difference between life and death in these contexts. All right, so they also dispense basic free medicines during these household visits. Now, all workers are given basic training, uniforms, and medicines for distribution from a recruiter in the urban area. Okay, so the government health services established a role. So the government established program in 2001 after the World Millennium Goals were posted, but they weren't able to manage to roll this out until 2009. What the program was supposed to do was it recruits women locally. It recruits men or women locally. In practice, most of the time it's women. The women are unpaid volunteers motivated by quote-unquote altruism. And here, we don't mean altruism literally. We mean altruism in the sense of the literature, which is it includes one blow, caring about prestige, so on and for without money. So they aim for one health worker. In practice, they were never able to get more than one worker per village, and half of the communities they weren't able to recruit any workers. And according to the government recruiters that we talked to, and when you read these government reports, the main constraint is labor supply. It was very difficult for them to find a person who was both willing and able to do the job in each village. And again, just to emphasize, while regional recruiters obviously know where the government workers are because they're resupplying them regularly, there's no aggregate data or record of where these health worker locations are. There's not even an initiative to collect the data, right? So you talk to a regional recruiter, she's like, I know where they are, no one ever asked me. Like, there's no one that I could even turn this data up to. All right. So the NGO we study is one of the largest in the world. It has similar aims as a government. It provides exactly the same health services free of charge when we looked at the training manual and the instruction manual for the NGO workers, it's even the phrasing is similar to the government manual. And this isn't a coincidence, it's because they were both sort of inspired by the Millennium Development Goals. All right, so in addition to the health services though, the NGO workers sells household commodities at a piece rate. So this is what we call the dual task model. This model has gotten a lot of awards. People call it the Avon model of aid. And the idea is that by selling household commodities, these are health commodities, for a piece rate when they make the home visits to these households, the workers are helping both the households by giving them the, by selling it to them without making the household travel to urban areas to search for it. And they're also helping themselves because they're earning a wage, and this helps the NGO be more sustainable, like financially independent. So basically all of the world's largest NGOs like Ramin, BRAC, Living Goods, Vision, Springs, they've all been adopting the dual task model, and it's been getting a lot of awards and acclaim in the aid community. All right, so the NGO rolled out in 2010. The government program was already in place. There was a government worker in half the villages. The NGO also recruited locally. They look for similar skills as a government worker. The NGO actually tries, so the NGO that we study, it's like one of the best NGOs in terms of being aware of the issues and trying to avoid it. So they actually try avoiding hiring government workers, at least at the central level, right? If you look at the manuals for recruiting, there's actually saying, try to avoid hiring a government worker. But in practice, the question is, what we're going to see is that in practice, they don't actually do it. And maybe it's because they can't screen out government workers. Maybe it's because, ultimately their mandate is to hire someone. So if that's the only person or the best person, they're just going to hire that person.
Just to give you a time check, Nancy, you have about 15 minutes.
Okay, great. So I'm going to skip this. And then I'll also and try to dive into the results. So in terms of data, just to give you a sense of timing, we have a baseline survey that's collected right before the NGO rolled out. It's at the village level and also at the household level. It's a 20% sample of all households within each village. We oversample the relevant population of households with young kids or expecting mothers. So then we have a 2010 census survey that we use for the balance checks. And then we have a 2012 N-line survey of outcomes. And between our baseline and N-line is about 2.5 years. So you should see these results as medium run results. Okay, now a few important facts. So NGO workers earn about $19 for 13 hours per week. This is less than what an entry-level doctor earns, and similar to what an entry-level nurse earns in the city. So it's quite a lot of money for a rural person. We have personnel data on all the NGO workers. I don't have much time, so I'm not going to go through all of this. I want to emphasize two things. One is only 24% have completed secondary education. Presumably, these are the most educated people of the village. All I'm saying is that there's not many, there are very few skilled workers in this village. The second thing I want to show you is in panel B. So if you look at the number of those who used to be the government health worker before the NGO entered, it's 21% in all villages. But then if you go and look at amongst villages that had a government health worker in 2010, it's about 40% of the villages. And then if you look at the villages with a government health worker in 2010 and none in 2012, it's about 82%. So that reflects the fact that there are some villages where the NGO just goes and hires the government worker, and so that there's no more government worker at N9. All right, I'm not going to talk about this. This is just a balance check of the randomization. The only thing I'll say is that we didn't conduct this RCT, so the randomization wasn't stratified by whether there was a government worker at baseline or not. However, when we look at the data, there's no statistical difference in NGO entry, even within the villages that had a government worker. So we just got lucky in the balance there. All right. Now let me show you results about capacity. So because I'll go very quickly over panel A, which are villages that had no government health worker in 2010, and focus my attention on the villages with a government health worker in 2010. So in villages where there is no government worker in 2010 at baseline, there's no issue of crowding out. And what you see in panel A is that when the NGO enters, it doesn't change the presence of a government health worker. It increases the presence of an NGO worker or total worker by exactly 1. That's what columns 2 and 3 tell you. Now, in columns 4, 5, and 6, this is a household survey saying, did you see a health worker from any of these organizations? Not surprisingly, when the NGO enters, households are more likely to see a health worker from the NGO or from either organization, right? So that's very straightforward to understand. Now let's look at panel B. So this is our focus for when we think about crowd out. So these are villages with a government health worker at baseline. When the NGO comes, you see that the presence of a government worker goes down by negative 0.43. So that's basically 1 per every other village. Column 2 says that the NGO comes and they always hire 1 person per village, right? So column 3, not surprisingly, says that on average, the total number of health workers increased by half. When we look at column 4, 5, and 6, what we find is that when the NGO comes, the probability of getting services from a government worker goes down. That's not surprising because there's fewer government workers. The probability of getting health services from an NGO goes up. Again, not surprising because there's more NGO health workers. That's my 3-year-old, full of life as usual in the background. And then in column 6, what we see is that surprisingly, the probability of getting health services from either NGO or government health workers go down when the NGO enters. And when we look at, we're going to dive into this a little bit more by looking at a decomposition. So basically what I want to do now is I want to kind of dive into this poaching idea. I want to see if is the NGO really hiring government workers, and when it does, what are the downstream consequences? For this, I'm going to pull the data, all the villages with and without an NGO worker, and do a decomposition exercise, right? So I'm going to regress outcomes on whether there was a government worker at baseline, whether the NGO entered, and then the interaction of government worker at baseline, NGO entry, and whether the NGO hired the government worker, and then the interaction of government NGO entry and whether the NGO hired a second person. The hiring decision is an outcome. This is why this is a descriptive decomposition. And then I'm going to control for area fixed effects because this is stratified. The randomization was stratified by area. But I'm also going to control for a lot of things because of this. Because one thing is, you might be concerned that the places that hired a government worker was very different from a place that didn't hire a government worker. So I'm going to control for a lot of variables that proxy for access to healthcare providers, baseline mortality rates, village demographics, household characteristics, and proxies for wealth. And then all of these things I'm going to interact with NGO entry, whether the NGO hired a government worker, and NGO entry where the government hired a second worker, right? So we're controlling for basically as much as we can. So you can, so if you think that we've controlled for all of the differences between these two types of villages, you can interpret beta 1 and beta 2 as causal. If you think that there are motive variables, you should feel free to interpret beta 1 and beta 2 as descriptive, which is what we do in the paper. All right, so let me show you what it looks like. And I want to focus on columns 2, 4, and 6, which is the ones with the controls. Actually, we don't have much time. Let me just focus on column 6. Column 6 is the probability of getting health services from either the government or the NGO worker, right? And what the first coefficient says is that in villages where there's only a government worker and the NGO doesn't enter, the probability is 40% above baseline. And I should say the constant is 19%. So the baseline in villages where there's nobody, 19% of households will see someone, right? And they do this by walking to another village. So the government, it's 40% higher if there's a government worker. If the NGO enters a village where there's no government worker, that probability increases by 33%. So the first triple interaction tells us the differential effect of NGO entry on a village with a government worker, where the NGO hires the government worker. So to get the main effect, just go to the bottom where we sum up that and the NGO interaction, the uninteracted NGO coefficient. So what we see here is that when the NGO enters a village with a government worker and hires a government worker, the probability of services goes down by 23.7 percentage points relative to when there was only a government worker. And in the second row beneath it, we see that when the NGO enters and hires a second person, the probability of getting any services doesn't change relative to when there was just a government worker. Now, I want to look at downstream outcomes with my remaining few minutes. And so let's look at column 2. So column 2 here is the probability that a household experienced any infant death in the last since baseline. And again, what we see for the first, we see that the constant tells us it's really high, 12.9% of households experience some infant mortality. So this is a population with very high birth rate, very high infant mortality rates. In villages with a government worker, and only a government worker, that's going to be 7.7% lower. In villages with only an NGO worker, that's going to be 6.8% lower from the baseline. And on the very bottom, what you see is that when the NGO enters a village with a government worker and hires that government worker, the probability of mortality goes up by 9.4 percentage points relative to when they only had a government worker. And the second coefficient says that if they hire a second worker, there's no change in infant mortality, right? And column 4 shows you, instead of looking at the probability of death within the last 2.5 years, we look at death rates, mortality rates at the village level, and we see something similar. But the interesting thing, the only difference is that now the estimate for when the negative coefficient for when the government hires a second worker is now statistically significant. Sorry, they're both statistically significant. So when the NGO enters and hires a second worker, mortality rates actually go down. And earlier we showed you that the probability of any services doesn't change for these guys. So this tells us that what's going on here is that the amount of services, which we can't measure very well, and the quality of services must be improving for these villages. When we look at other health outcomes, other health behaviors, we see consistent coefficients, just less precisely estimated. For example, child health behavior, like do they wash their hands and things like that, this is self-reported. The same thing in column 6. When the NGO enters and hires the government worker, it gets worse relative to when there was only a government worker. I think I have Emma, do I have 1 minute left? Is that right?
You have 2 minutes left.
Okay, great. Thank you for letting me stay on time. I just want to talk about the interpretation in the last 2 minutes, like what's going on here. So the questions we want to ask, is why do government workers move to the NGO? That seems clear. But the ones who move, they offer higher pay, right, relative to no pay. So that's why some of them move. And then the second question is, why are they providing fewer health services when they move? And again, the two things that we can show, I'm going to offer you some descriptive evidence, is negative selection and a reallocation of time. So the commercially motivated workers are more likely to move. When they move, they allocate more time to selling stuff and less time to providing health services. That's why it is in these villages where we see the shift that health outcomes worsen, because you're getting fewer and lower quality services. And so this is, we're not going to have time to look at it in detail, but this is a survey of all workers who apply to the NGO from the same NGO in a different part of Uganda. And, they actually say, do I care about money, respect, helping the community? And the government workers who applied, 40% care about money. The ones who didn't apply, only 26% care about money. And when we look at time allocation, this is also not our data. The NGO that we studied did an internal survey of time allocation of its health workers in Uganda. And what you see here is that they spend very little time providing healthcare. That's the things on top. They spend most of their time selling health commodities, selling medicines, and attending refresher training in the urban areas. And the NGO actually says that most of the time attending refresher trainings is going to the warehouse and restocking their supplies. So if you take the time allocation data here literally, and the fact that our NGO workers work about 13 hours a week, and data from another study that government workers typically work 10 hours a week, spend all of their time providing healthcare, then if you take all this really literally, then when someone switches from the government to the NGO workers provide 30 to 70% fewer health services. Okay, last thing, column 2. So I just want you to look at the dependent variable is a probability that the local school was open last week. And basically what I want you to look at is the uninteracted NGO coefficient. So this is NGO entry in villages where there's no government worker at baseline. And we know that NGO hires a worker, health outcomes improve. What you see here is that the probability that the school was open last week goes down by 5 percentage points. And this is sort of what makes us worried that they're actually hiring the teacher. And we're still working to see if we can say something a bit more about school closings, but right now it's sort of suggestive that there might be crowding out issues, even in villages where there was no government worker at baseline. Okay, so this is my last slide. I think I've already said all of this in the beginning, so I'll just be very quick. So our evidence, we think that we're showing kind of new evidence that supports the concerns of NGO provided aid crowding out government services. And the downstream implications are potentially very serious because this is an environment that's very sensitive to interventions. You can make things a lot better or a lot worse with a few basic services. So our takeaway is just that there's a lot of room for improvement. I mean, there's a lot of easy policy takeaways from this paper, right? Like NGOs can pay lower wages closer to the government. They can avoid going to where the government is. The government should try to keep data on where its workers are. The NGOs should share where it's working. Everyone, should share data and just coordinate. And then this parallel task model needs a lot more thinking through before it's rolled out everywhere. And that's it. Thank you so much. I'm happy to talk more, obviously.
Thank you so much, Nancy. That was a great presentation, really fascinating results. So we do have some questions already. So firstly, I see Chris with his hand up in the panel.
Thanks, Nancy, super interesting. So I guess I would have, leading up to your last slide, said this is all about not providing incentives for the NGO workers to provide the basic services. It looked like you showed pretty convincing evidence that they're just deflecting off to something that's just selling this stuff. And so what is there any incentive other than intrinsic incentives for them to provide these basic health services? What has the NGO tried to do? Because I wouldn't take the lesson that they need to stay away from government employees and that sort of stuff. I would just take the lesson that this dual model is really shifting their efforts.
Yeah, sure. I mean, it depends on what you care about, right? If you care about building up government capacity, which we think we need for sustainable development, then you just don't want them to hire the government workers. And as long as they offer higher wages, regardless of what the pay structure is, the workers are going to be going. And then as long as you're paying higher wages, they're going to be selecting people who care more about money. So that you don't need the dual structure for that. But if you care about downstream outcomes, which I think many of us are like, what we should just take care of infant mortality now, and because who knows? I mean, you can make a case. Who knows how Uganda will develop? Let's just think about the downstream outcomes. Then you're exactly right. Then it's like, well, we need to kind of think about how to design well, still there's two things. We want to try to make sure that we're not selecting the people who just care most about money, right? The ideal people, there's two layers of design for the NGO to think about. One is selection. Like ideally, they want the people who are really, really wanting to help people, but who are just too poor to work part-time. Like they need to try to find those guys somehow, instead of the people who are able and just really want to make money. So I don't know how to do that. I mean, like, I think Erica and others are like really trying to figure out this. And it's an open and really important question. The second thing is what you said, and this is sort of like where we're touching on, is conditional on working for the NGO, whatever your type is, how do we get you to provide more health services? And the NGO, I mean, so, and it's sort of hard, right? Because so one thing that I can tell you what they're actually doing. So in our context, they're actually not, they didn't do anything, but in other contexts, meaning like other similar NGOs in other places, they try to actually experiment with just paying people to make health visits, right? So every household you visit, I pay you something, but that introduces potential distortions of its own. And I think we're waiting for some evaluations to see like what the what the net effect is. And then people have talked about just paying a flat wage. I mean, it's sort of like the Holmstrom-Milgram model of multitasking, right? Like, how should we do it? And I think it's like an open question, and we don't really know. I just want to say one more thing. So the incentive misalignment comes from the fact that the households that are targeted by this particular mission, which is health and infant mortality, are so poor that they can't really afford to buy much. This actually works really well. There's no misalignment in, for example, you know, if you're rolling out microloans for farmers and the thing you're selling is like a hose, then there's really no misalignment, because the people who have the money to buy the hose and want to buy the hose are also probably the people you want to target for the loans, right? And so this misalignment is also something, I think there's also benefit for us just to think through the misalignment and figure out when the dual task model can work.
Just a quick follow-up, and I'll get out of Kate's way. But it's not obvious to me that if I think about long-term government development, that I don't want these people to work for the NGO for a while. They may get much better skill acquisition. They may acquire much better skills working for the NGO in the long run. That might be better for local governments as well.
Yeah,
so that point's not quite obvious. But I do think this this question of when these things are aligned and when they're not is a really interesting one.
Yeah, I totally agree with that. So I only had time for one bullet point, which is a caveat at the end, which is that long run effects can be really different from short run effects. And that's exactly how we're thinking about it, right? We're 2.5 years out. We try to go back and collect data, but unfortunately the NGO did a full rollout, so we can't study the long run effects. But you can imagine that the long run, the 10-year out effect can be different, because a lot of other things can be happening that's good for everyone.
So we have Kate Orkin next.
Thank you. It's super interesting work, and I mean, must have been really something to run. So it's a very cool experiment. I was thinking, sort of just looking at the downstream health outcomes, I wonder if one other implication for policy is like just the effects on infant mortality are pretty massive when you compare them to some other interventions. So whether it's government or NGO, like I think there seems to be a big message of putting more staff in these communities matters. You know, there's been this huge fuss about chlorine dispensers, and they don't get significant effects on infant mortality, or the effects are like 1 or 2 percentage points. So I think that was quite an interesting thing of sort of bodies on the ground matter. But I was interested then if you could comment a bit also on how this links. I know Pascaline Dupin has done some work on finding that community health workers actually aren't that effective. And I wondered if you were able to comment a bit more on what they might be doing in both cases that reduced infant mortality so much. Because in my mind, that wouldn't have been so much about the, you know, that was a little bit more clinic based. So I think that might be an interesting thing to flesh out a little bit more.
Yeah, no, I think that's a really good point. Unfortunately, I'm the wrong co-author to answer that question. So let me make two corrections, apologetic corrections. One is we didn't run the experiment, so we can't take credit for that. The NGO ran it, and they were just really generous and shared the data with us after the fact. The second thing is I don't actually know much about healthcare in Africa beyond our own context. Erica would be a good person to answer that question. But I can tell you about the government workers in our context, because when we started this, I went in with a superficial understanding that government workers didn't work, and Erica went in with a strong, she went in with, like an informed prior that government workers may not be effective. And when we found our results, we were a little bit surprised. So we really dug into like our context. And so it turns out that, so this is, our government program is a Ugandan VHT program. So then we looked at a lot of other studies looking at the Ugandan VHT program in similar contexts, and they all find that the government health workers are quite effective. And the sense of why they're effective for infant mortality, one is simply that these are places where people have nothing, and infant mortality rates are so high at baseline. So just doing very little things that doesn't require a huge amount of effort has high returns, right? So literally what's, I think infant mortality rate, 12.6% of households in our context experience at least one infant death. I mean, in the last 2.5 years, right? The infant mortality rate is like 100 and something, 120, I mean, don't quote me. It's like over 100 per thousand. So the things that they're doing to get these big effects is literally like, like I had a child and Kate, you visit me and I have a fever, and without you, I would have just stayed home, or my baby has a fever, would have stayed home and given it water and aspirin. But you say, you really need to go to the clinic because you have an infection. I go to the clinic, and then you ask, the other thing you do for me is you call the clinic because absenteeism is a big problem. And you say, when are you going to be there? Because you're going to come at 2 p.m. tomorrow. And the health workers will be there 2 p.m. tomorrow. The mother then goes at 2 p.m. tomorrow, and they're just given antibiotics. And then, nobody dies. So I think part of the reason is the type of intervention that we're looking at, and our kind of extreme context of the ultra poor and high infant mortality.
Yeah, thanks. That makes a lot of sense.
I think if none of the panelists have a question, there was one asked in the Q&A a bit earlier about whether you think this is about general crowding out, e.g. could this be private versus public crowding out, or whether it's something specific about NGOs?
Yeah, I don't see a big difference between, NGOs are private nonprofits. In this case, it's a private nonprofit. I don't think there would be a big difference if it was not private. Similarly, the fact that it's crowding out the government because it pays more. If it wasn't government provided services, if it was like privately provided services that paid less.
Oh, I think I might have lost Nancy.
I'm here.
Sorry, we lost you for a minute or two there, or the last sort of sentence or two you said.
Oh, I just said I wouldn't expect the fundamental economic forces to differ if the NGO is private versus public, or the government, the local services are privately versus publicly provided.
Yeah. Great. Well, I think we're just about out of time now. So thank you so much, Nancy, for your presentation. I think we already enjoyed it, and I hope you also got some good questions from us. So thank you very much, everyone, for joining today. And next week at the same time, so at 4 p.m. UK time, we have Jeremy Magruder, who's going to be presenting factor market failures and the adoption of irrigation in Rwanda. So I hope all of you can join us next week. And thank you again, Nancy, for your presentation.
Thanks so much, everyone, for coming in, for the really, really great questions. Email me if you have any more thoughts. Thank you.
Bye, everyone. Thank you.